In today's Simple Health, June is Men's Health, and it's dedicated to raising awareness of preventable health issues and encouraging men to get early treatment and detection.
And today we want to focus on prostate and testicular cancers and the impact on men in Central Texas. Joining us is Dr. Lucas Jacomides, a urologist at NAU, a urology specialist, and St. David's North Austin Medical Center. Thank you so much for being here with us.
Thank you, Jennifer. Appreciate it.
Okay, first let's start with prostate health. What are some symptoms that men really need to look into and could really signal concern about prostate cancer? What do they need to look out for?
Well, interestingly, prostate cancer is one of these subtle, sometimes completely asymptomatic diseases that you don't know you have it until perhaps it's too late. So it's a simple test that we check, a PSA or prostate-specific antigen. And we usually recommend start checking it at least at age 50 and maybe even 45 or even 40 for some of the higher risk patients. So in terms of symptoms, difficulty urinating, decreased flow, things like that, hesitancy, emptying problems is one of the first signs. But of course, that could be a sign of just benign growth and not cancer. The ones we worry the most about are blood in the urine and especially bone pain, like you have metastatic disease. But that can take 10 years to take place before you start to feel symptoms.
Oh, wow.
Oh, wow. Okay.
Wow.
Well, let's talk about I always have trouble saying testicular cancer. What are the symptoms of it?
Well, Mike, contrary to the prostate cancer, that one's fairly easy. You feel something different. You have an asymmetry. You have two testicles, you feel one mass that doesn't feel like the other one, and you say that is something very abnormal. And contrary to prostate cancer that can take 10 to 15 years to show up, disease elsewhere, testicular cancer can actually double in size in a month or two. So usually when we say you feel something, when we get a call at our office at NAU, urology specialists, we'd say get that person in today or tomorrow. Because we want to make sure we get on it right away.
Okay, and we know that early detection is key. What are the treatments for both of these cancers?
Well, testicular cancer is easy. You take it out day of. Dr. Schaff, one of my surgeons where I train, said that the sun should never set on testicular cancer. So if you feel it, take it out that night or at least the latest the next day. Then after that, you do radiation or chemotherapy, depending on how involved it is. As far as prostate cancer, because it's so slow growing, the first step is getting a diagnosis. So then you say, okay, I have it. You wait actually about 6 weeks until you treat it to let the inflammation from a biopsy go down, and that's how we find it. One option, the classic, is to take it out. And immediately guys say, I don't want to do that. I want to have my continence, my potency afterwards. I don't want to risk that. And so they're looking for less aggressive options. That's where radiation therapy comes in. And then we're doing something now at St. David's Surgical Hospital called HIFU, Focal One HIFU, High Intensity Focused Ultrasound. It's the only one in the city. And it's phenomenal. I've been doing them for about 6 years now. The second guy I ever did 6 years ago, the first day I ever did it, he ran a 10K a week after his surgery. So it's really amazing to get people on there, and he still has disease-free.
And it's less invasive too, that particular
Less
procedure?
invasive. They go home same day. They have a catheter in for about 5 days. And then we just take it out, and then after that, they're on their own. And then usually it's a great recovery.
I think the real thing here is early detection because you don't want to have to get to that point. But so it's really always worth remembering. All right, Dr. Lucas Jacomides, thank you so much for joining us today.
Appreciate you. Thanks for having us.
We'll be right back.